Hello, I'm Dr Lindsay Hughes. I'm a senior lecturer in the health psychology section at King's College London, and today I'm going to be talking about management of a long-term condition during COVID-19. Most pre-existing conditions such as cancer, diabetes or asthma require long-term management that is often lifelong. This might include taking regular medications or sticking to a diet or exercise regime. Although COVID-19 is an important immediate health situation that we're all dealing with, there are some extra considerations for people who have long-term conditions. It's really important to stay well in order to fight COVID-19, so it's vital to follow the government guidelines. This includes practicing shielding if you're in a very high-risk vulnerable group to minimise the number of people that you come into contact with. You should keep washing your hands regularly and practice social distancing to prevent the spread of the virus. And follow your regular treatment plan unless specifically told otherwise by your doctor. You might be worried about continuing to take your medications at the moment, especially if they have an impact on your immune system, but it's really important to stick to your regular routine. It can help to think about the pros and cons of continuing your medication or stopping your medication to help you to commit to a regular schedule. For example, some of the pros of continuing to take your medication are that it's safer to keep to your regular treatment schedule. The precautions such as shielding will reduce your risk of contracting COVID-19, and continuing your treatment will maintain your long-term health. Some of the cons to stopping your medication include that you would be less able to cope with COVID-19 if you had a flare-up. Stopping some medications abruptly can be dangerous, and you'll feel better in the long run by keeping control of your health. If you have a long-term condition, it's really important to know your body and recognise when you need to ask for help. You might find that you're more aware of your usual symptoms at the moment because of the focus on health in the media and because you don't have the distraction of leaving the house or going to work. If you feel like your symptoms are starting to flare, then you could monitor the frequency and intensity of them for a couple of days to help you identify whether it's a true flare or if you're just having a bad couple of days. If you do feel like you're flaring up, follow the treatment plan that you have in place with your healthcare professionals. There's also lots of information on patient charity websites which are easily accessible from the home pages. But ultimately, you know your body and you know your symptoms. If you need to speak to a doctor, use 111 or call your GP or your specialist. It's really important to stay well during this time and to recognise when you need to ask for help, even if you think that everyone else is busy with COVID-19 at the moment. Now, evidence shows that more treatment is missed when we're outside of our usual routine, for example, at the weekend or when we're on holiday. We're all getting used to a new routine at the moment with the government restrictions, but there are some tips that can help. For example, you can associate regular treatment with an everyday task, such as having your morning cup of tea or brushing your teeth. If you keep your equipment or medication in the associated area, such as next to the kettle or by the sink, it will remind you to take your treatment. It can also be really difficult to remember to take a regular treatment if you're distracted or if you're taking care of loved ones. So take the load off and set an alarm on your phone for your medication or ask family and friends to remind you. It's also really important to make sure that you have enough of your medication, especially if you need to self-isolate. Plan how and when you will order your repeat prescriptions and ask friends and family to help collect it if you're shielding. But remember that you don't need to stockpile more than your usual amount. Your long-term health goals are still important even when dealing with COVID-19. Set yourself some medium-term goals for your health during this time. That might include continuing to take your medication or keeping up with a diet or exercise regime. Make it manageable and reward yourself when you succeed. You might want to plan a special outing or retreat when the government restrictions are lifted to reward yourself. But remember, it's really difficult to stick to any health behaviour, so congratulate yourself on any successful outcomes. You can also support loved ones who are living with long-term conditions. Remember that people might be particularly worried or confused at the moment about the impact of COVID-19 on their long-term health, especially if they're in a vulnerable group. Listening to their concerns and following guidelines on social distancing and shielding can help to support them. Some people also find it helpful to have family and friends remind them to take their medication, but remember that most people will already have their own techniques and nagging is just going to have the opposite effect. Some ways that you can help might be to eat or exercise together, to go and shop for food or pick up medications if someone is shielding, or just to think of ways to keep people entertained if they're social distancing or shielding. But most importantly, remember that nobody is perfect and everyone can have a bad day. Have compassion for yourself and each other and treat each new day with a fresh start. Thank you very much for listening and stay safe.